Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 555 of our pharmacotherapy series, which majors in schizophrenia. JPJ has been stabilized on ziprosidine 40 mg twice daily with meals while in the hospital. When should her target symptoms start to respond to the medication? What else can be done to help improve JPJ's prognosis once she is discharged? Although JPJ's symptoms should start to decrease within a few days of starting the medication, it may take a week or longer to see significant improvement. At this point, she may be stable enough for discharge from the hospital, but still show some functional deficits. It may take several more weeks, possibly months, for her to return to her baseline prior to her symptoms starting, and she may never fully reach this point. The utilization of non-pharmacologic methods, including individual and group therapy modalities, could also help JPJ's continued improvement and stabilization. Education for both her and her family could also be of benefit to her. JPJ returns home to her family, taking a leave from college for the remainder of the semester. She returns to school the following semester to resume classes, but notices she has a hard time focusing in class, which she attributes to the ziprosidine. As she has not had any psychotic symptoms since being released from the hospital approximately 5 months ago, she thinks she is cured and no longer needs to take the medication. She contacts her psychiatrist about stopping the medication. Should JPJ discontinue her medication at this time? What do practice guidelines state regarding JPJ's treatment needs at this time? JPJ should not stop her medication at this time. Although a medication adjustment might be needed, depending upon the nature and cause of her concentration, that is not a reason to stop the medication altogether. Most treatment guidelines recommend a minimum of 6 months, and preferably 1 year, of treatment after a psychotic episode. As she has only been symptom-free for 5 months, JPJ's risk of relapse is very high without medication treatment. Ultimately, JPJ decides to stop taking her ziprosidine and stops going to her psychiatrist appointments. In less than a month, she is brought to the emergency room by her parents as she has relapsed into another psychotic episode and admitted back into the hospital. Is JPJ a candidate for long-acting injectable antipsychotics at this time? JPJ is not a candidate for a long-acting injectable antipsychotic currently, as she has never tried an oral formulation of any of them to this point. Recommendations for use of a long-acting injectable antipsychotic require at a minimum repeated dosages of the oral form of the medication to ensure a lack of an allergy to the med, or in some instances for the patient to be stable on an oral dose of the medication and the converted over to the long-acting injectable antipsychotic form. However, she might benefit from the use of a long-acting injectable antipsychotic if she truly intends to be non-adherent with oral forms of antipsychotics. As she has only shown non-adherence to one medication trial due to a potential misunderstanding of her illness and her treatment, she could benefit from education in these areas to improve her adherence. In addition, her family could be educated to help JPJ maintain her med adherence as well. While on the inpatient unit for this most recent episode, JPJ continues to remain non-adherent to oral medication. She eventually agrees to receive a long-acting injectable antipsychotic, but after speaking with her insurance, the only atypical antipsychotic long-acting injectable antipsychotic they will pay for is risperidone long-acting injectable antipsychotic. Is this an appropriate agent for JPJ, and why or why not? Assuming that JPJ has been administered oral risperidone in the past, which ensures a lack of an allergy to the medication, it still would not be an appropriate option at this time. Due to the unique pharmacokinetic parameters of risperidone long-acting injectable antipsychotic, it requires 3 weeks of overlap of oral medication, risperidone or otherwise, as the initial dose does not begin releasing medication until this time. Assuming JPJ's non-adherence to oral medications will continue, this could lead to a poor outcome, especially if she is discharged from the hospital. JPJ's insurance should be contacted to attempt to find an alternative atypical antipsychotic long-acting injectable antipsychotic. So there you have it. Our highly esteemed viewers and listeners, that brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom, and if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 556.